Hello, my name is Marlene Como and this is Jason Como, and today we'll be performing a head-to-toe assessment and recording it for the purposes of this project. Jason, do we have consent to record?
Yes.
Okay, thank you. All right, so first we'll start by performing hand hygiene. Okay. All right, so next I'll be inspecting your head, your hair, cranium, and scalp. Okay? Let me know if you feel any tenderness. Any tenderness?
No.
Okay. And just tilt your head towards me. Thank you. Okay. Any tenderness there?
No.
Okay. All right. Now, if you would raise your eyebrows. Okay. Good. Stick your tongue out and say ah.
Ah.
Okay. So now we'll perform a gag reflex. I don't actually have the tools needed, which would be a tongue depressor, but we'll pretend. And I would touch the back of your throat, and we would see the gag reflex. Okay. All right. Next, I'm just going to place my fingers here. Open your eyes. Okay. I'm going to hold with my fingers. Just shut your eyes. Don't let me keep them open. Good. All right. So next, inspecting the nose. Everything looks good. So just occlude one nostril, the right, and breathe in and out. Good. Now the other side. Good. Okay. Now open your mouth again for me. So inspecting the oral cavity, your tongue, and gums. Now clench your teeth. Good. All right. So I'm going to try to open your mouth. Don't let me. Good. Okay. All right. Now I'm just going to do a little jaw test. Okay. Any tenderness?
No.
Open your mouth. Good. Now move your chin side to side. Any tenderness there?
No.
Discomfort? Okay. All right. All right. Now puff your cheeks out for me, like a blowfish. Good. All right. So now I'm just going to feel your sinuses. Okay. Any tenderness?
No.
Okay. Any tenderness there?
No.
Okay. All right. Now I'm going to inspect your ears. Any tenderness here to my touch?
Nope.
Okay. Good. Any tenderness?
No.
Okay. All right. So now I'm going to do a whisper test, okay? So cover your left ear and repeat after me.
10 is 22.
Okay. And then cover your right ear and repeat after me.
Baseball 33.
Good job. All right. Okay. All right. And so now I'll feel your lymph nodes. Any tenderness?
No.
Okay, good. Okay. Any tenderness there?
No.
Okay. All right. All right, now, so I'll feel your temporal arteries and your carotid arteries. Okay, good. All right. So now, what we would normally do is what's called the Snellen visual acuity test. For lack of resources, I will just explain how the procedure works. So normally we would have a standardized chart, and I would have you read the smallest letters that you can read at a distance of 20 feet and compare to that of what someone with normal visual acuity could read at 20 feet to test your vision. Okay, so next, I'm just going to flash a light with my pen light into your eyes, and we're going to check the corneal light reflex. Okay, and just look straight at me. Okay, all right, and then next, I'm going to check your pupils for equalness, roundness, and reaction to light. Okay, so I'm going to flash a light to your eyes. Good. Okay. All right, so now I'm just going to come around to the back of you. And if you would just position a little bit more to the right, there we go. All right, and I'm going to feel your thyroid gland. So just feel the front of your neck here. Swallow for me. Good. And again. Good. All right. While I'm back here, I'm just going to be listening to your lung sounds and also just feeling your back for any tenderness. Okay, so let me know, is there any tenderness here?
No.
How about here?
No.
Any here?
No.
Okay. And here?
No.
Okay. All right, and I'm just going to do a little test. Tell me if there's any discomfort, okay? Any discomfort?
No.
Okay. Any discomfort?
Nope.
Okay. All right, so when I listen to your lung sounds, so you'll take a deep breath every time you feel my stethoscope touching your back. If you feel like you're getting short of breath, just let me know. We can take a break, okay? All right. Deep breath. Good. Good. Just a couple more. Okay, one more. Good. Okay. All right. So now I'll listen to the front of your lung sounds, okay? So we'll do the same thing. Okay, good. Thank you. All right. Any shortness of breath at all? Okay, good. All right. Now I'm just going to palpate your chest. Tell me if there's any tenderness there. Any tenderness? No. Okay. All right. So now I'll listen to your heart sounds with the diaphragm of my stethoscope. Okay, so now I'm just going to listen for about 15 seconds and try to oscillate your heart rate here. Okay, good. Okay, all right. Now, if you would just lay on your left side for me. Okay. I'm going to listen to your apical pulse or any murmurs. Okay, good. Okay, all right. Now, if you would come on and lay back down on the table. Rest your head on the pillow here. Okay. All right, so now we're going to do an assessment of your abdomen, okay? So first, I'll just be checking for tenderness, okay? Any tenderness here?
No.
What here?
No.
Here?
No.
Here?
No.
Okay. All right. All right, so first I'm going to auscultate your aorta for any bruit, and there's none, so that's good. Now I'm going to listen for your bowel sounds, okay? Okay, very good. All right, now, so I'm just going to do what's called percussion. in each quadrant of your abdomen, okay? Good. All right, and while you're laying down, I'll be looking at your jugular vein. So if you would turn your head to the left, just slightly, and just rest. Good. So jugular pulsation, and then look towards me. Okay. And then I'm just going to check. If you look towards me again, I'm just going to check for the vein distension. And then again that way. Okay, good. All right, you can relax. And while you're laying down, I'm just going to listen to your heart sounds again with the bell of my stethoscope. All right, and I'm just going to take my pen light and shine this light over your abdomen to check for symmetry. Okay, good. Okay. All right, so while you're laying down, I'm going to check for a range of motion in your legs, for range of motion in your hips, okay? All right, so first I'll have you raise your leg without bending your knee, straight up. Okay, and then bend your knee, bend it back. Good. All right, and then relax. Actually, one more thing. All right, so bend your knee towards me. Good. And now in towards your left. Good. All right, relax. Okay, so same thing on this side. So we're going to have you raise your leg straight up, and then bend your knee towards your chest. Okay, and then out towards me, and then back in again, keeping your knee bent. Knee bent. All right, and then straighten. Good. All right, now bring your left leg out towards me, straight out, and then cross over your right leg. Perfect. And then down. And same thing on this side. So come out towards me, back, and then over. Good. All right. Now, if you could point both of your feet inward without moving your knees, good, and then out. Okay, and then extend your feet, and then bring them back. And then if you could curl your toes, and then fan them out. Good. Okay. All right, so now I'm just going to inspect your toes and capillary refill. Feeling the temperature of your skin. Okay, just going to feel your pulses here, the popliteal pulse. And then a little pulse here, and then your pedal pulse. All right, and then Jason, if you would sit up for me. Okay, all right, so I'm just gonna test the strength of your arms, and we'll do there's some range of motion with your arms, which we would normally do in a sequence before we would have gone to the bottom. All right, so I'm gonna place my hands here. Can you shrug your shoulders? All right, raise your arms up. And then down. and back. All right, and to your side, and then up this way, all the way up. Okay, and then back down. Okay, and then, all right. And so we'll test the range of motion in your wrists. All right, so put your hands down, then up, and then to the sides, and then inward, and then make fists. Fan your fingers out. Okay. All right. And I'm just gonna inspect the capillary refill on your fingers. Okay. Okay, good. All right. And then I want you to bring your arm up, flex. All right, and don't let me come down, and don't let me push back. Okay, same on this side. All right, don't let me come down, and don't let me push back. Good. All right, so now I'm going to be assessing your brachial pulse on each side. Okay, and then your radial pulse. All right, and then I'm just going to check the strength in your lower extremities. Okay, so don't let me pull your leg towards me. Good. And now don't let me push. Okay, now this side. Don't let me pull, and don't let me push. Good. Okay. All right, so I'm just going to refer to my sheet once. All right. Okay, so I want to just next check the strength in your head and neck. So lean your head forward and don't let me come back. Okay, try to lean your head back, don't let me come forward. And then to the left side, same. And to the right. Good. Okay. All right. And then checking range of motion in your neck. Put your head back. Touch your chin to your chest. And touch your right ear to your right shoulder. Neutral, left ear, left shoulder. Okay, look to your right. And then look to your left. Any discomfort at all?
No.
Okay. All right. All right, so now I'll have you stand up. Okay, so we'll do a little bit of exercise here. So we'll have you bend forward, and then lean back, and then lean to the side, and to the other side. Okay, and then twist, yeah. Good. All right. All right. Next, we'll have you walk away from me. Good. All right. And now, when you walk towards me again, walk with your heel to toe, heels to toe. Okay. Walk that way. Okay. And now on your tippy toes. Good. And now walk on your heels. Good. Okay. All right. So, so next we'll do what's called the bending knee test. So stand on one foot, bend your knee down. Good. And then to the other side. Okay. Good. All right. And now I'll have you just stand still with your eyes closed, and I'll just watch and make sure that your gait is steady. Okay, good. All right. And there's actually just a few more things I want to test if you would just have a seat again. Thank you. So, so I'm going to have you close your eyes. And, all right, so I'm going to do a test. I have a cotton ball, and I want you to tell me when you feel a sensation and where. So keep your eyes closed. Okay.
My cheek, yes.
Keep your eyes closed.
My arm, yes. My hand, yes.
Which hand?
Left hand. On my shin, left shin, yes. My right foot, yes.
Good. Okay. All right, and there's one more thing I want to do. Okay, so I'm going to do a test to check your peripheral vision, which we would normally do in the beginning of the assessment, but it escaped me. So, all right, so what I'm going to have you do is put your hand over your eye like this, and I want you to tell me when you see an object appear.
I see. Yes. Yes.
Okay. And then keep that hand, yeah. And again.
Yes.
And look straight at me.
I see it.
Okay. And now we'll put your hand over the other eye. Same thing. Just look straight ahead at me and let me know when you see the object.
I see it. I see it. I see it.
Okay. And again on this side.
I see it. I see it. I see it.
Okay, good. All right. Now, so I just want you to look at my pen and follow the direction of the pen. And back. Okay, good. All right. And I'll refer to my sheet one last time. Okay. Okay, all right, Jason. Well, thank you for coming for the assessment today. And it's been a pleasure working with you, and thank you for letting us record.
All right. Thank you.